My name is Tressa Moeller. Today is the 19th of February. It is 9:30 and I will be doing an NG placement, meds per tube, and discontinuing an NG tube. So first off, I'm going to insert an NG tube. So I'm going to walk into the room, perform hand hygiene, introduce myself, and provide privacy. When doing this, I'm going to check name and date of birth of the patient with the order I have to place an NG tube. I'm also going to ask about history of an NG tube placement, nasal surgery, and explain the procedure to the patient if they have any questions. So before I get started, I'm going to raise the bed up to working height. I'm going to assess which nostril would be best to apply the NG tube to. I'm going to choose the right nostril. I am going to place a bin onto their next to them, just in case when I hit the gag reflex, if they throw up, or whenever I reach their stomach, if content comes up. I'm going to also place a towel across their chest. I'm going to get my tape ready. I will have one piece of tape to mark how far I go down with the NG tube. I will have one piece of tape to temporarily secure it before I check placement. I will have a piece of tape to permanently secure the NG tube, and I will have a piece of tape for a safety pin to be attached to. There we go. Now that I have my tape secured and ready, I'm going to apply gloves. Okay, I'm going to measure how far I need to insert. So this is from the nose to the ear, and the ear to the xiphoid process. So this would be at 50. I'm going to apply the piece of tape. Okay, now that that is marked, I'm going to loop 4 inches of the tube. I'm going to have him extend his neck backwards and have this cup ready for him to take sips of water whenever I have reached the gag reflex. So I'm going to insert into the nose with his head extended. Once I hit the gag reflex, I'm going to have him lean forward and have him take sips of water, and every time he takes sips of water, I will advance the tube. Sip, advance, sip, advance, sip, advance. So now that I have hit my marker, I'm going to temporarily secure it to the side of the cheek. I'm going to verify that it's not coiled up in the back of the mouth, and then I can check placement. So I can extract GI content, and the pH should be between 1 and 5, or I can instill 10 to 30 mils of air and listen over their stomach for a whooshing sound. But the best way to verify placement is through X-ray. Also, if it would happen to be into the patient's lungs, they would be turning blue and having shortness of breath, and their O2 levels would be going down. So if that would be happening, I would immediately remove the NG tube. So now that I have verified placement, I am going to secure it to their nose, so I could clean off their top of their nose prior to putting the tape on. I'm going to put one to the side just to get that tape out of the way. I'm going to go around the tube and back up. now that it's secured to his nose, I'm going to put this piece of tape, giving him enough slack. And I would put the safety pin through the piece of tape and onto his gown. So now that the NG is placed, I would document how the procedure went and if he had how much content he had if I hooked him up to the suctioning. But for now, I'll just leave it unhooked because we'll be giving meds. I would also document how far I went with the NG tube, so the next shift can know that the tube is still in place by how far it is into his nose. So now that I have documented all I needed for the insertion of the tube, I'm going to do med placement, or giving meds per tube. So if I would have left the room or done anything outside of his room, I would come back and check placement before I would give any meds. So I'm just going to instill 10 to 30 mils of air, listen for a whooshing sound, and then I can do meds. So before giving meds, I would still do my checks at the Pyxis, coming to the room, still do the checks with the patient, identifying the name and date of birth, and that the medicine's the right dosage, and the med can be crushed. So when giving meds by tubes with NGs, you're going to have 10 or 20 mils of normal or sterile water before you give a med and in between each med and after the med. So you can either do a piston syringe and you can push it through, or you can let gravity. So today I'm going to have gravity do it. I'm going to unhook the meds or the suctioning. I am going to now flush with 20 mils of solution or sterile water. I'm going to unhook from his gown because I don't think it's going. So now that the flush has been done, I can pass a med. So I'm just gonna, instead of using gravity, I'm just gonna push it in. I'm going to flush again. Pull up my second med. The most important part, if you're pulling up the med instead of using gravity, is to make sure that you are getting all the liquid out of the piston syringe. Is really hard to pull meds with. So now that meds have been pushed, I would not hook him back up to suctioning for 30 minutes after the med administration to make sure the meds have been absorbed. So I would put the stopper back on and meds are complete. So my next thing I'm going to do is remove the NG tube. So before I remove the NG tube, I'm going to perform hand hygiene like normal, but verify that I have an order to remove the NG tube. I would assess the bowel sounds. I would make sure that they have no nausea or vomiting recently, and they have not been hooked up to suctioning for more than 30 minutes, or haven't been for more than 30 minutes. So if I have known all of those things, verify their name and date of birth, I am going to remove the NG tube. So I am going to undo the safety pin. I am going to now undo the tape, and I'm going to have them take a deep breath and explain that this will be a little bit just uncomfortable, but it will be less than what it is when it would be putting in, and I will slowly pull out the NG tube. When the NG tube's out, I will verify that the tip is still intact, and this would be coiled up in my hand, and I would throw it away. I would document how he did with the procedure, and I would put him back into the comfortable position he would prefer. I would get him all cleaned up, give him a Kleenex if he needed it, and make sure I have his call light.